Good morning, student. Our today's class is on the anatomy of nose and paranasal sinuses, part first. The learning objectives for my today's class are: at the end of this session, students should be able to describe external nose and its features, skeleton of the nose. They should be able to describe nasal cavity and its communications, regions of the nasal cavity. Blood vessels and nerves of the nose will be also described in this session. We will also describe applied anatomy of nasal cavities. The nose consists of external nose and the nasal cavity. Both are divided by a septum into right and left halves. Each half is called nasal cavity. As shown in this figure, nose is divided by the septum into two nasal cavities. Parts of external nose. External nose is pyramidal in shape. It has a root, an apex, which is also called the tip of the nose, dorsum, which is called bridge of the nose, external nares or nostrils, which communicate with the external environment. It is through these nostrils that air enters the nasal cavity. Columella is the most anterior portion of the nasal septum and forms central fleshy portion between two nostrils. Ala nasal or the lateral mobile flaring wall of each nostril. The external nose has two elliptical orifices called nares or nostrils, which are separated from each other by nasal septum. The lateral margin, the ala nasal, is rounded and mobile, as already said. Now, what are the various functions of the nose? The various functions of the nose are: nose acts as a respiratory passage for the air. Olfaction. Nose is regarded as an organ of smell. Receptors for smell are located in the upper third of the nasal cavity. Filtration. Vibration and respiratory mucosa secreting mucus trap dust and other particles, thus filtering the air. Humidifying and warming of the inspired air is another important function of the nasal cavity. Nasal cavity proper, which is lined by a highly vascular respiratory mucosa. This mucosa contains goblet cells which secrete mucus. This mucus traps the dust particles which are expelled from nasal cavity by ciliary action of ciliated epithelium. Lightening of the skull. Since nose is associated with paranasal sinuses which reduce the weight of the skull, these sinuses also produce resonance to our sound and act as shock absorbers. These sinuses are also important for the growth of facial skeleton. Nose is also cosmetically important, being the most prominent projection on the face. A beautiful face is incomplete without a beautiful nose. Now let me ask you, what is a beautiful nose? Or what are the features of a beautiful nose? The size of the nose should be proportionate to the size of the face. The length of the nose should be one-third of the distance from hairline to chin. Breadth of the nose should be one-fifth of face. Frontonasal and nasolabial angles also contribute to the beauty of the nose. In a beautiful nose, in males, the frontonasal angle should be 115 and nasolabial angle 90 degrees. In females, frontonasal angle of 120 and 105 contribute to the formation of a beautiful nose. These dimensions become important during rhinoplasty, that is surgical reconstruction of the nose. For the nerves which supply the external nose. The muscles which are attached to the external nose are supplied by the buccal branch of the facial nerve. So buccal branch of the facial nerve is motor for the muscles attached to the nose. Sensory innervation of the nose comes from infraorbital nerve, which is a branch of ophthalmic division of trigeminal nerve. External nasal branch from anterior ethmoidal nerve also supplies the nose. Infraorbital nerve also supplies the external nose. It is a branch from maxillary division of trigeminal nerve. As shown in this diagram, infratrochlear nerve is branched from ophthalmic division of trigeminal nerve. Infraorbital nerve is branched from maxillary division of trigeminal nerve, and external nasal branch from anterior ethmoidal nerve also supplies external nose. Framework of the external nose. External nose is made up of bones and cartilages. It is formed above by nasal bones, the frontal process of the maxilla, and the nasal part of the frontal bone. Below the framework is formed of palatus of hyaline cartilage. So this diagram makes skeleton of the nose very clear. Nose has bony and cartilaginous framework. The bones which contribute to the formation of the nose are nasal bones, as shown in this figure. The two nasal bones join each other at internasal suture. Frontal process of the maxilla also contributes to the formation of skeleton of the nose. Nasal part of the frontal bone. The cartilages which participate in the formation of the nose are the septal cartilage, which separates the two nasal cavities, the lateral nasal cartilages, major and minor alar cartilages, which contribute to the skeleton of nose. Interior of the nose is divided into two nasal cavities by nasal septum. Each half extends from anterior to posterior nasal apertures and has superiorly roof which separates it from the anterior cranial fossa, inferiorly floor, and it also has lateral and medial walls. Dimensions of each nasal cavity are: height is about 5 centimeters, length is 5 to 7 centimeters, and width is 1 to 2 centimeters near the floor, but 1 to 2 millimeters near the roof. Interior of each nasal cavity is divided into vestibule. Vestibule is basically the hair containing part of the nose. It is lined by the skin. The nasal cavity proper is lined by respiratory epithelium. Each nasal cavity has lateral wall which separates it from the paranasal ear sinuses and orbit. Medial wall, also called the septum of the nose, separates two nasal cavities from each other. Roof separates nasal cavity from anterior cranial fossa, and the floor which separates each nasal cavity from oral cavity. Vestibule is the hair containing part of the nose. Nasal cavity proper, as shown in this diagram. Nose is divided by nasal septum, divided into two halves. Each half is called a nasal cavity, and each nasal cavity has a medial wall which is formed by the septum, roof which separates it from the cranial cavity, floor which separates it from the oral cavity, and lateral wall which separates it from paranasal ear sinuses and lateral wall of the nasal cavity. The lateral wall presents bony projection is covered by epithelium called turbinates or concha. Each turbinate is narrow, curled shelf of spongy bone. They protrude into the breathing passage of the nose. They are shaped like an elongated seashell. They divide the nasal cavity into four groove-like air passages. Functions of nasal turbinates or concha are: they increase the possible surface area of nasal mucosa. These bony conchae are lined with pseudostratified ciliated columnar epithelium. The mucus secreted by goblet cells of this epithelium traps dust particles, and ciliated epithelium helps in their removal. Thus, it clears the air of dust particles. These turbinates are also responsible for forcing inhaled air to flow in a steady and regular pattern. Lining mucosa of these turbinates also warms and moistens the inhaled air in preparation for lungs. In other words, they cause air conditioning of the inspired air. This function is made possible by large surface area and high vascularity of nasal mucosa. Now, where from these turbinates or conchae originate? Inferior is the largest and an independent bone. There are three concha: superior, middle, and inferior. Inferior concha is the largest and independent bone. Middle and superior conchae are projections from ethmoidal labyrinth, superior concha being the smallest concha of the three. These bony projections lined by mucosa are called the turbinates. If we take a coronal section of the nose, it is divided into two cavities, right and left, and each cavity is called a nasal cavity. Septum separates the two nasal cavities and forms the medial wall of each cavity. From the lateral wall project three bony projections. These bony projections are named as inferior, middle, and superior. They are lined by the mucosa. Below the inferior bony projection is the inferior meatus, and accordingly below the middle and superior bony projection lies the middle and superior meatus. Thus, these bony projections or turbinates divide nasal cavity into four tubes. Lateral wall of each nasal cavity is irregular, presents three conchae. Lateral wall of the nose presents three bony projections called conchae. Superior concha is shortest and shallowest. Middle concha is a large concha, articulates with the palatine bone. Inferior concha is an independent bone, articulates with maxilla. Later bony projections lined with mucosa form concha or turbinates. So there are three turbinates: superior, middle, and inferior. Corresponding meatuses and openings. Sphenoethmoidal recess is a small space posterior to the superior turbinate. Sphenoidal ear sinus opens in it. Superior meatus lies below the superior turbinate. Posterior ethmoidal sinuses open in it. Middle meatus lies below the middle turbinate. Anterior middle ethmoidal sinuses open in it. In addition, frontal and maxillary sinuses also open in the middle meatus of the nose. Inferior meatus of the nose lies below the inferior turbinate. The only structure opening in the inferior meatus is nasolacrimal duct. Features below the middle meatus. Below the middle meatus there is hiatus semilunaris. Hiatus semilunaris is a crescent-shaped groove in the lateral wall of the nasal cavity, just inferior to the ethmoidal bulla containing middle ethmoidal ear sinus. It is limited below by edge of the unsnake process of ethmoid. Medial wall of the nose consists of nasal septum. As already said, it is divided into the columnar septum, which is the anteriormost part of the septum. Membranous septum lies between columnar septum and septal cartilage. Septum proper, which is made of cartilages. Septum is composed of bones and cartilage. The structures which participate in the formation of the nasal septum are septal cartilage, vomer, perpendicular palate of ethmoid. In addition, there is some minor contribution from nasal bone, frontal bone, sphenoid, palatine bone, and maxilla. Roof of nasal cavity. The roof of nasal cavity separates each nasal cavity from anterior cranial fossa. It is about 7 cm long and 2 mm wide. It slopes downwards both in front and behind. Anterior slope is formed by the frontal bone. Middle or horizontal slope is formed by cribriform palate of the ethmoid. Posterior slope is formed by body of the sphenoid. The roof is divided into three regions: sphenoidal, ethmoidal, and frontonasal region. As shown in this diagram, sphenoidal region is formed by the sphenoid, ethmoidal region, and frontonasal region. Before going to the floor of the nasal cavity, let us go to this diagram. Floor of the nasal cavity separates it from oral cavity. The bones which contribute to the formation of the floor are palatine process of the maxilla, as shown in this diagram, horizontal palate of the palatine bone. Palatine process of the maxilla also bears in the midline incisor foramen, leading into incisor canal, also called foramen of Stenson. Through each of these foramen ascends the terminal branch of greater palatine artery, while as nasopalatine nerve descends. Communications between the nasal cavity and surrounding structures are: each nasal cavity communicates through anterior and posterior nares with external environment and pharynx respectively. Incisor canal, as already described, through this canal it communicates with the oral cavity. Greater palatine artery ascends through it from oral cavity and enters the nasal cavity, whereas nasopalatine nerve enters the oral cavity after passing through this canal. Cephalopalatine foramen. The structures which pass through the cephalopalatine foramen are cephalopalatine artery and nasopalatine nerve, which enter the nasal cavity. Cribriform palate of the ethmoid, which forms the roof of the nasal cavity. It is sieve-like. Olfactory nerves leave nasal cavity and enter the anterior cranial fossa, where they form the olfactory bulb. Foramen cecum is a communication between the anterior cranial fossa and nasal cavity. Occasionally, an emissary vein is present in this foramen, which drains into the superior sagittal sinus. Anterior and posterior ethmoidal foramen carry artery and nerve of the same name. In addition to these, small foramina are also present in its lateral wall. Blood vessels of the nose. Let us go to the arterial supply of the nose. As already said, nose is divided into external nose and nasal cavities. The external nose is supplied by the terminal branches of internal and external carotid arteries. As shown in this figure, external carotid artery gives facial artery, which in turn gives superior labial and lateral nasal, and from lateral nasal we have alar branches which supply the external nose. Terminal branches of the internal carotid artery in the form of ophthalmic and dorsal nasal also supply the nasal cavity. Infraorbital artery also supplies the nasal cavity. Nasal septum is very important clinically. It is supplied both by terminal branches of internal and external carotid artery. The terminal branches of internal carotid artery which supply the nasal septum are: one of the terminal branches, ophthalmic artery. Ophthalmic artery gives anterior ethmoidal and posterior ethmoidal arteries which supply the nasal cavity. From external carotid artery arises facial artery. Facial artery gives superior labial artery. From the superior labial artery, we have the septal branch, which is also called the coronary artery of the nose. Also, external carotid artery gives maxillary artery, and from maxillary artery, greater palatine and sphenopalatine branches supply septum of the nose. So nasal septum is supplied by anterior and posterior ethmoidal arteries, which are branches from ophthalmic artery, which in turn is branched from internal carotid artery. It also receives blood supply from superior labial, greater palatine and sphenopalatine arteries, which are the terminal branches of external carotid artery. As already said, arterial supply of nasal septum is very important clinically because anterior inferior quadrant of the nasal septum is commonest site of bleeding in epistaxis. So we again repeat the arterial supply of the nasal septum, anterior ethmoidal arteries, posterior ethmoidal arteries, which are branched from ophthalmic artery. It is also supplied by sphenopalatine artery, greater palatine artery, and septal branch of superior labial artery. The later three are branches from the external carotid artery. Now, these arteries anastomose in the anterior inferior quadrant of septum to form an arterial plexus called Kiesselbach's area or Little's area or Little's triangle and is the commonest site for epistaxis. What is this Kiesselbach's plexus or Kiesselbach's area? It's also known as Little's area or triangle. It is located in the anterior inferior quadrant of the septum. 4 or 5 arteries anastomose there. These arteries are the terminal branches of internal and external carotid arteries. As already said, anterior ethmoidal, posterior ethmoidal, septal branch of superior labial, greater palatine, and sphenopalatine. Anterior ethmoidal arteries branch from ophthalmic artery. Posterior ethmoidal branch is branched from ophthalmic artery. Sphenopalatine is branched from maxillary artery. Greater palatine branch from maxillary artery. Septal branch of superior labial artery. Septal branch of superior labial artery is also called the coronary artery of the nose. Kiesselbach's plexus is commonest site of epistaxis. What is epistaxis? Bleeding from the nose is called epistaxis. Common causes of the bleeding from the nose are traumas, as occurs in nose picking, hypertension, bleeding disorders, and malignancy, angiofibroma in young adults. It is managed by nasal packing. Nasal packing is of two types: anterior nasal packing, as shown in this diagram, and posterior nasal, where we apply pressure to stop bleeding. Venous drainage of nose. Veins of the nose follow arteries. Nasal veins. The veins of the nose are nasal vein. It enters the foramen cecum and drains into superior sagittal sinus. As already said, nasal vein is not always present. When present, it passes through foramen cecum to drain into superior sagittal sinus. It is a potential pathway for spread of infection from nose to meninges. Anterior and posterior ethmoidal veins drain into the cavernous sinus. Sphenopalatine veins drain into pterygoid plexus of Venous. Septal vein drains into the facial vein. So the veins of the face drain into nasal vein drains in the superior sagittal sinus when present. Anterior and posterior ethmoidal veins drain into cavernous sinus. Sphenopalatine veins drain into pterygoid plexus of the Venous, and septal vein drains into the facial vein, as shown in this diagram. As already said, each nasal cavity is divided into vestibule. Vestibule is the hair containing part of the nasal cavity. Nasal cavity proper. Nasal cavity proper is the part of nasal cavity which is lined by respiratory epithelium, that is pseudostratified ciliated columnar epithelium, and olfactory region. Olfactory region is lined by the olfactory epithelium, and this region is responsible for carrying sense of smell to higher center. Vestibule is the region of the nose which is lined by skin. So it contains hairs called vibrissae. So hair follicles are present there in addition to the sebaceous glands associated with them. Olfactory region, upper third of the nasal cavity, forms the olfactory region of the nose, includes its roof, lateral wall, and medial wall up to the level of superior concha. This region is lined by olfactory mucosa, which is thinner than the respiratory mucosa. It contains olfactory cells which are responsible for sense of smell. Respiratory region. It is lined by pseudostratified ciliated columnar epithelium. It helps in clearing and conditioning of the inspired air. Mucous membrane lining this region is highly vascular and shows variable thickness. Innervation of the nasal cavity. Each nasal cavity is innervated by nerves which carry superficial sensations, general sensations, and it is also innervated by the autonomic nerve. Sensory nerve supply of nasal cavities. Each nasal cavity is supplied by the superficial nerves in the form of olfactory. General sensations are carried by anterior ethmoidal nerve, branches of sphenopalatine ganglion, branches of infraorbital nerve. Olfactory mucosa contains olfactory cells. The axons from these cells tears the cribriform palate of the ethmoid to form the olfactory bulb. Olfactory bulb leads into olfactory tract, which terminates in the primary olfactory cortex. Olfactory nerve differs from other cranial nerves in that it has the power of regeneration. It bypasses the thalamus in contrast to other sensory impulses which pass through the thalamus. A word about the olfactory nerve. It is a sensory nerve containing axons that conduct impulses for olfaction, the sense of smell. The olfactory epithelium occupies the superior part of the nasal cavity, covering the inferior surface of the cribriform palate and extending down along the superior nasal concha. This nerve arises from the olfactory epithelium, passes through the cribriform palate of the ethmoid, as already said. Fibers run through the olfactory bulb and terminate in the primary olfactory cortex. Function solely by carrying afferent impulses for the smell. Innervation of nasal cavity and nasal septum is shown in this diagram. Both nasal cavity and nasal septum, the olfactory area is lined by olfactory epithelium, which is responsible for sense of smell. The lateral wall is supplied by anterior ethmoidal nerve. Nerve gives external branch called external nasal branch of anterior ethmoidal nerve. It is also supplied by posterior superior lateral nasal nerves and also by posterior inferior lateral nasal nerves. Other sources of nerve supply are nasal branch of anterior superior alveolar nerve. So facial sensations from septum are also carried by olfactory nerve. Septum also receives this nerve supply from septal branch of anterior ethmoidal nerve. Nasopalatal nerve, after supplying the septum, leaves the nasal cavity to incised canal to enter into oral cavity. The autonomic nerves of each nasal cavity. Parasympathetic fibers are derived from the greater superficial petrosal nerve. These fibers originate in the superior salivatory nucleus. They join the deep petrosal nerve carrying sympathetic fibers from first and second thoracic segments from superior cervical ganglion. The two nerves join together to form median nerve or nerve of pterygoid canal. Preganglionic parasympathetic fibers relay in the pterygopalatine ganglion and postganglionic fibers are distributed through nasal and palatine nerves, whereas sympathetic fibers are distributed with blood vessels. As shown in this diagram, greater petrosal nerve is joined by deep petrosal nerve to form the nerve of pterygoid canal or median nerve. The parasympathetic fibers carried in this nerve relay in pterygopalatine ganglion. From there, these fibers are distributed with nasal nerves to each nasal cavity, whereas the sympathetic nerves are distributed with blood vessels. To make things more clear, from superior salivatory nucleus, seventh cranial nerve arises. A branch of the seventh nerve is greater petrosal nerve, which carries parasympathetic fibers. It joins the deep petrosal nerve, which arises from internal carotid nerve. Internal carotid nerve is basically the sympathetic plexus around the internal carotid artery carrying postganglionic sympathetic fibers. The two join together to form the nerve of the pterygoid canal or median nerve. The parasympathetic fibers relay in the pterygopalatine ganglion and are distributed by nasal nerves to the nasal cavity, while the sympathetic fibers are distributed through blood vessels. The diagrammatic representation of from superior cervical ganglion we have internal carotid nerve, which forms the deep petrosal nerve. Deep petrosal nerve joins the greater superficial petrosal nerve from facial nerve, which carries parasympathetic fibers from superior salivatory nucleus. The two join together to form median nerve or nerve of the pterygoid canal. The parasympathetic fibers of this nerve relay in pterygopalatine ganglion and supply nasal gland. Sympathetic fibers cause vasoconstriction. They decrease nasal secretions. Parasympathetic cause opposite effects. They cause vasodilatation and increase in nasal secretions. Lymphatic drainage of each nasal cavity. From external nose and anterior part of the nasal cavity, lymphaticus drain into submandibular group of lymph nodes. The rest of the nasal cavity drains into jugular nodes either directly or through retropharyngeal nodes. I want to summarize my lecture as under: nose is divided into external and internal nose. Internal nose is divided into two halves by septum and each half is called nasal cavity. Each nasal cavity has a roof, floor, lateral wall and a medial wall. Framework of nose is formed by bones and cartilages. Nose acts as a respiratory passage with air conditioning properties and also as an organ of olfaction. It is supplied by the terminal branches of external and internal carotid arteries. Topographically, nose is important as it is related to the anterior cranial fossa, pharynx, paranasal ear sinuses, and oral cavity. Rhinoplasty is plastic reconstruction of the nose, as a beautiful nose is an important component of a beautiful face. Next session will be on anatomy of nose and paranasal sinuses part 2nd. Thank you for watching this video. Do not forget to like, subscribe and share this video.